All right, so I'm gonna show you on a real person here. Hava's gonna come in and join me about how we tie on a tourniquet, okay? So once I've gotten my supplies all set up here, now each supply kit's a little different. And like I said, I like to look down. This looks like there's a pair of gloves here. I already have gloves on. So I'm just gonna set that to the side, okay? I have my label on how I label my IV site. Got some iodine. Like I said, it's kit dependent on what we want to use. I'm going to use an alcohol pad. There's a Band-Aid for if I have to take it out. Tape, gauze, things like that. Okay? So you got everything ready. And this is a good time to second guess yourself, really. Second check yourself. Make sure you have all your supplies because you don't want to have the needle halfway in your patient's arm and forget something, right? That's not a great time to run out of the room, okay? Like I said, I have two different IVs here. All right, we can go ahead and take this time to talk about the colors of them. Okay, so you see those are both blue. All right, technically that's a little purple, but they're both blue. So blue 22. That's how I remember it. Sounds like a football call, but blue 22. Okay. There's pink, which is a 20. Pink or red is 20. Green is 18. And yellow is a 24, but we're in an adult health setting, so we probably won't see those much. Those are mostly for your babies. Now, what we shoot for on an adult patient is a pink or red, which is a 20 gauge. That's pretty standard across the board. If the patient has to go to surgery, if they need to get blood, if they need a bolus of fluids, things like that. So the smaller the number, the larger the gauge of the IV. Okay. So blue 22 is kind of a smaller gauge, all right? But that's what we're gonna use today just based on availability. But judging of his veins, I would most likely go to 18 or 20 right off the bat, okay? So once I've seen what I'm working with, then I'd wanna tie my tourniquet on, okay? I'm gonna use Hava's arm here to show you, all right? So you wanna make sure that you use both hands, all right? You pull the tourniquet, stretch the tourniquet before you place it on your patient's arm so that it doesn't grab their skin. Does that make sense? Like if I didn't do that and I put it on and then I pull, you're gonna pull her hair and pull her skin, especially on our older patients, okay? So you stretch it, pull it to the skin, come around. Everyone has a little bit of different technique here, but make sure you have your little pigtail that you can just automatically release, okay? So stretch it, pull around. See, I use both my hands here, and then I make a little pigtail for a easy release here, okay? Now you want to make sure that the patient's arm is tilted in a downward position for gravity to flow and start filling up their veins. Sometimes I make my patient pump their fists just to kind of get some blood moving, right? As we can see, there's automatically popping up some veins here. You see that? We see the color, we see the vein popping up, right? See that color down in there? Okay? Now once you see, not all the time you can see people's veins, okay? Hava has great veins here, so we can touch on them. We want them to be bouncy, not very movable, right? But we say we want to avoid this area, so we kind of look down, around. This one, bouncy, straight, okay? So that's what we're looking for on someone's veins. Now, I don't need to just leave her sitting here with this tourniquet on as I get my position and move my supplies and all those things. So once I have found a site that I want to go to, I pop my tourniquet so that it's, giving the patient some release, and I go finish setting up my supplies to get ready to accomplish the task, okay? Thank you, Hava. I'm actually gonna use your chair here. So, we save our backs in healthcare, so if I don't have a chair, I'd want to pump up the bed to bring the patient to me. Because if I'm sitting here like this the whole time while I'm doing an IV, it's very uncomfortable for me and bad for your back, okay? So you'd want to pump up the bed. Make sure I'm not breaking something. Gotta be aware of your surroundings. To my height, if there's not a chair. Okay, if there was a chair, I could sit and leave him where he was. Just depends on what you got, but you can do it either way. So we'll pump up our chair here. Mr. Jimmy here is a great patient, so I'm gonna move my supplies to him so that I'm not constantly reaching back and forth. Okay? This has a little cap on it, all right? And as I'm here, I am gonna completely set up everything I need so that I am not having to release anything. Like everything will be completely set up. So like I just did, I just released that bubble from the flush. Okay, I need to hook it into my pigtail device. Right, this usually has a cap on it. All right, and then I have a trash can right here. I need to flush my line so that there's no air in that line. Okay, so then that's set back right here. All right, and like I said, like I just noticed, I don't have a tegaderm, which is the clear plastic covering that goes over once I'm done to secure the IV. So I need to go grab a tegaderm. So, yeah, cool. All right, so here's the tegaderm. So like I said, every pack's different. So, and sometimes you'll go 1 week and then it'll be different the other week. Just depends on your facility. Okay? So this is the IV catheter that has the automatic gel in there. Now what I'm talking about when I do that is that when I insert the IV, you'll get flashback of blood. We're not going to on Mr. Jimmy here. But in this part right here, when I insert it, there'll be blood that fills this little chamber here, and you can see it. Now once you see that flashback, you stop inserting the needle. Okay? So you stop where you are and you feed your catheter off, and I'll explain that a little further. But when you remove it, blood doesn't flow back out of the catheter. There's a gel in there that prevents that from happening. Not every facility has that. That is why I have my towel, okay? If you ask your friends that are in nursing school, this is a great lifesaver, because if your towel's not here and blood, you know, you might make a little mess. It's okay, especially when you're learning. Now we don't have to clean the whole sheets, okay? It's just saving your work and your time, okay? So, Mr. Jimmy, I'm gonna tie this tight tourniquet on you, okay? It may be a little tight, but let me know if it's too uncomfortable, okay?
All right.
Okay.
Can I call you May?
You can.
Okay, May.
You can call me May. All right. So I give it a little time. If his veins are very good, okay? But if they weren't really popping up, I would get him to kind of pump some fists for me, you know. Just gonna look, okay? All right, so I'm gonna start an IV right here on Mr. Jimmy. Mr. Jimmy, is this spot right here okay?
Sounds good.
Okay, so the first thing I'm gonna do is clean. Some packs have alcohol preps and some packs have little chlor preps. All right, it doesn't matter, essentially. It's hospital facility specific. You just need to make sure that you clean very well. All right, so I'm gonna scrub that site 20, 30 seconds, scrub really good. Okay, there's visible dirt there. If I need to get another pad, whatever I need to do to make sure it's super clean. Well, then I need to make sure it dries. Now, Mr. Jimmy's skin here may take a little bit to dry. Might take a long way to dry. Obviously, we don't want to fan it. You definitely don't want to blow on his skin. Okay, those are no-nos in practice. But our skin dries a lot faster than Mr. Jimmy's here. Okay?
I think it's dry, May.
Okay, good. All right, so like I said, you know, his tourniquet's on this whole time, okay? So see, this is a little 22. We need to make sure that the bevel is up. Y'all have heard that before. Bevel is up, okay? So I hold it in between my 2 fingers. Some people may want to do these 2 fingers or these 2 fingers. Either way, you need to hold it with 2 fingers, okay? I like to do it with these 2 fingers so that I can push that little notch. See that little notch right there? So if I'm holding with these 2 fingers, this finger is free to push that notch off when it's time to put the catheter into the skin, okay? All right, so always want to notify your patient before you do something. So, okay, Mr. Jimmy, you're gonna feel a little pinch down here, okay? I'm gonna insert this needle, try not to move, okay? All right, so you come to the skin. Before you put the needle into the skin, make sure you're at an angle here. You don't wanna be 90 degrees, right? And be right up against the skin, okay? So big poke, big poke. All right, I push the skin. I'm gonna pretend like it's about right here that you would see that flashback. So this chamber right here would fill up with blood. So I would stop advancing the needle. And see how I have my other fingers down on his skin as like an anchor point, okay? So as soon as I see that flashback, I'm gonna push off with this finger here. And see how this spot doesn't move, okay? So now that that is almost to this, the hub is to the skin, then I pull that back, right? And you see how it's kind of wanting to come, and then that's removed. This is no longer a needle inside of there. The needle is inside of this, okay? So that's a safety device. Now, like I said, this has a gel filler in it. So there's nothing coming back out, right? So I want to make sure this is somewhere where I know exactly where it is, okay? I want to take this, undo the little safety cap here. This is when you can use 2 hands. And push this up into the catheter and twist that, okay? So IV is in. If I was going to draw blood from this, I would keep the tourniquet, but I'm just going to flush it, okay? So I need to make sure that I pop the tourniquet prior to flushing so that, you know, now it's able to flow, all right? Now this is a slow flush. This is make sure that you have placement, okay? So as I flush very slowly, I want to put fingers here to make sure that there's not coldness of the fluid going out into the skin. It's going to feel, you should feel it kind of whoosh under your fingers up the vein, okay? And it's flushing very easily. I can feel it under my skin. So I would say that's a successful IV here. Okay, we're still not done. We need to connect this to his skin. All right, we need to anchor it down. So this is the part they need to be very careful because you just worked so hard to get it in and the patient did such a good job, all right? So I have my tegaderm, right? And I'm gonna put it over his skin like that, okay? Now this, every tegaderm is different too. So there we go. This might need to, there we go. Okay, so it's stuck down and it's clear so I can see exactly, you know, around the site, things like that. And you'll see this part done differently. This is really your preference on the tape part, okay? Some people like to anchor it down around. Like I said, it is totally your preference. You just want to make sure that it's done well. This is my preference, right? I like to do one right here, okay? And then I like to bend this up because we just don't want to leave this hanging free. So you always need to anchor this down. Whether you want to anchor it, you know, on this side or on this side or wherever you want to put it, okay? Then I use another piece of tape. And some people pre-rip it. It's okay, either one. And you will get stuck on your gloves. And so then I just make a little anchor piece. Okay, so now we have an anchor. So now when I connect the fluids to this, if it gets caught on him or something and pulls right here, it's not gonna pull this area because this can be very tender for the patient. You definitely don't want that to come out. So you have an anchor here. All right, so this goes in the sharps. This is what our needle was in. Our flush needs to go in the sharps, and anything else that you have needs to go in the sharps. This is where you clean up. Mr. Jimmy, you did a great job. Now I'm gonna start some medications on you, okay?
Okay, sounds good.
All right, so I've checked my order, and it is for lactated ringers, 500 milliliter bolus, okay? So what is that? You know, I'm gonna give you some fluids here to help hydrate you. The doctor ordered it at this rate. So I'm gonna put it on a pump, okay? So go over pump tubing here. This is how it's packaged. You see there's a couple of little pieces of paper holding it together to keep it getting from so tangled, basically. And then there's this little protective cover here, okay? So a bunch of little trash pieces here. All right, I like to clamp first. Like I say, you see a couple different people do things a little different way when you're following your nurse, but don't be discouraged because it's all the same. You get the same finish line, okay? So pop this part here. This one has, this port is where this fits into, and this is a needle port, which we don't usually access, okay? And they may look a little different in the hospital, okay? But if you try to put this sharp into there, it's gonna be very difficult, okay? So it goes into here. Sometimes it takes a little twisting motion back and forth, but whenever you're putting it in, you want to make sure that this line is a full fit to right there. It's not barely in there. It's not hanging out at all, okay? So then when I turn it, I have it clamped so nothing's happening. All right, then I'm going to set it on my pole, okay? This is where I like to go ahead and take off these little pieces of paper so that I can make sure there's no kinks in my tubing. Everything is straight, things like that. Okay? Now before I place it to the pump, sometimes we get a little ahead of ourselves and want to go ahead and put it in there, but it's not primed at all. It's just straight air into this. All right? So I need to unclamp it and see how you can start to see some fluid flow there, and I follow it through my line. And I have a trash can down here that I'm gonna let this flow into. So here comes, I can just follow it down the line. I don't know if you can hear that, but it's kind of dripping into the trash can very slowly because I have it slowed down. And I don't see any air in the line, so I can clamp it back off to make sure that the flow has stopped, okay? Now I need to look right here, make sure there's no big bubbles in this tubing. Right in this part, because this is what the pump detects, okay? So now that my line is completely flushed, I'm gonna get the pump ready. Like I said, this is a 500 milliliter bag of lactated ringers. That's a bolus. So sometimes your order just says bolus, okay? You're thinking, oh goodness, what's the rate of a bolus? All right, that's as fast as your pump will allow it to go, okay? So as I turn on my pump for the first time, new patient, Mr. Jimmy's a new patient here, so I'm gonna click yes. All right, are we on the oncology floor? Yeah, we're on the oncology floor. All right, some facilities will allow you to scan the armband of the patient, you know, things like that. We're not gonna do that today, okay? So now it's ready for us. So it tells us that there's only one selected or one attached here. These can go on and off, and you can add several different letters. But we have A here and A here. That's the only one that we have to choose from. Okay? So this is where some people do this first, some people do it in the middle of this. This part goes first into this little slide, and then you put that in, and then I can close it. See, it already starts beeping on you. Okay? Then after I've done this, I can now undo my rolly clamp, and since it's clamped on the inside, it will not flow. All right, I'm doing a basic infusion. All right, and this is where you gotta do just a little bit of math, okay? So if I have a 500 milliliter bag at bolus, that's as fast as the pump will allow it to go. My rate is gonna be 999, okay? 999 milliliters an hour. That's as fast as the pump will allow you to go. And then the volume to be infused is how much I'm wanting to put in, okay? That's 500. Now, you'll see some people, not 5,000, 500. Some people will put in the exact number on the bag. Some people will do less. It's really up to you. I could put in 450 and we get the same result, right? Okay, so now it's waiting on me to hit start. Well, what I need to do first is hook this up to my patient, okay? Now, this is a lure lock, and it twists right on. All right, you want to make sure it's good. I just started this IV, so I don't need to make sure that it's patent because I just did it. Once everything's hooked up and it's correct, I can hit start. And as you can see, it's actively dripping. Now, when your rate is really high, such as a 999 rate, this will drip pretty continuously. Obviously, if it's a 30 milliliter an hour rate, it will go much, much slower because this is putting the fluid into the patient. Okay, stand here for a minute or so, make sure this is flowing here, make sure that everything is open, clamp's open, patient site looks good. Ask Mr. Jimmy if his arm feels comfortable.
Yep.
If it was uncomfortable, we need to troubleshoot a little bit. And there we go. All right, so I actually need to start one more IV on this patient and just have a saline lock because we can, sometimes that's for like ICU patients, if this patient needs to receive lots of medications, things like that. So we're gonna do the exact same thing, but I'm gonna start another IV so that the medication nurse can come in and give like push medications and things like that, okay? So just make sure I have my supplies. This time I'm gonna use a little different catheter. Get my other kit.
Go ahead, stop it, because I don't know if he's got a bag yet. I don't know how big of a bag to put in there, but we're good.
All right. So like I said, this is my trash. Let me get my other kit. Other pigtail. Other flush. All right. So make sure I have my supplies again. This is a little different kit, so you'll see a little different cleaning device used. right? Like I said, we need to pre-prime our, this is a good time to show this. Your flushes come pre-packaged with a little bubble in them, okay? So and this is tight around the syringe. So you'll see a lot of people wanting to push it forward and it pops and it hits the ceiling. There's a trick to that. If you just pull the plunger down, that breaks the seal. And then you go slowly back up to get the bubble out. Much neater. You won't squirt your patient or their family member in the face or your instructor. All right, so it's a great trick to do, okay? So then I'm flushing this line, it's ready. All right, have all my stuff set up. I've already looked at Mr. Jimmy's arm. I know he has another vein for me to choose from. You'll see the difference in this IV catheter. This, for instance, is one that's used at St. Vincent's. It's much smaller, but it's essentially the same thing. Now, this does not have that gel inside of there to prevent the blood from flowing out. So this one you will need to apply pressure above the site for it not to make a mess, okay? But we insert it the same way. All right, pull my supplies over. Okay, Mr. Jimmy, we're gonna do the same thing, okay? I've got to start one more IV on you because you got to get a lot of different medications, okay?
Okay.
All right, so like I said, pull tourniquet tight under the patient's skin, up and around. Make sure that no clothing or anything is in the way. And there we go. Turn my pump off since we're gonna give that a pause. All right, I see what I'm looking for. I'm gonna start this one a little different here. I'm gonna start on this side so that they're not in the same vein. Okay, so like I said, Mr. Jimmy has a fistula over there, graft, so we can only use one arm. So in practice, you don't want to use the same vein, okay, because a little higher, a little lower. So I'm gonna use a different vein to be safe, just in case those medications weren't compatible. Okay, so this is a ChlorPrep. All right, now the way that you activate it is you squeeze in both these wings till you hear a pop. See that let down the fluid? Give it just a little shake just to mix up the ingredients. And then you can see the solution filling into that pad. If you just kind of press, it activates it. So this is a mixture of chlorhexidine and alcohol. Like I said, facility specific. I'm gonna scrub, 20 seconds. Back and forth, round and round, just scrub. Scrub, 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 scrub. Vigorous scrubbing, okay? Now I'm done with that. Okay, like I said, Mr. Jimmy's skin here takes a while to dry. We would not do this in practice, but I'm gonna keep this is the one that you can make a mess on, okay? Don't let it startle you. So this is set up a little different. That is what I'm gonna push off with my finger, okay, that little ridge there. Same thing, bevel needs to be up. I hold this lower part with these two fingers so that this finger is free to push off, okay? So, Mr. Jimmy, gonna be a big poke, okay?
Okay.
So make sure that your angle is correct. Insert in. We'll pretend like I have flashback. Now the flashback in this catheter is gonna be right here. Okay, it's gonna fill it with blood as soon as you get into the vein. This part stays still and I'm only gonna push off the catheter. You see how this isn't moving, but this blue part is? You get to the ridge there. This is my needle. This one doesn't retract, but as you pull out, a safety cap will come over the top of that needle. So as I pull out, I'm gonna apply pressure above this catheter. So the safety cap is on that needle there, okay? And you know this needle, see how this would simulate blood, okay? See how blood's kind of creeping out, okay? You know, your catheter is about 1 inch long, so you don't want to put pressure directly on the catheter, but you want to go up a little bit. Apply great pressure, okay? Sometimes if you have a buddy in the room, they can help hand you supplies, but you can get good at one-armed, okay? This inserts here, and then you screw that on tight there. Then you can release the pressure because no more blood is exiting. Like I said, we're not getting blood, we're only flushing for medication, so I need to pop my tourniquet here, put my hands above here, flush nice and gently and easily, make sure that it's flowing good, no swelling, no coldness, no pain from the patient. There, I'd flush all 10 cc's there. When you disconnect here, this does not allow blood out, okay? So then same thing as we did earlier. Now, Mr. Jimmy's a great patient. He's not gonna move and flail his arms around. if you do have that patient, you're gonna need a buddy to help you hold it in place, okay? Put my Tegaderm on here. Clear, clear, clear. I need to anchor that extension tubing there, okay? So a bunch of kits come with the IV site label. You put what gauge it is, so this helps not only for the next nurse that comes on your shift, but if he goes to a procedure, this also is information that you need to document into the computer. So for this IV, for instance, I would fill out my gauge and what day it was inserted and my signature. But when I go back to the computer, I would document blue is 22, so I document a 22 gauge IV catheter, saline lock, right? Saline locked to the right forearm, okay? It's patent, it's intact, it's taped, the dressing is clean and dry, things like that. So that's what I would document into the computer. This one here, blue also, so blue 22 IV, because it's not saline locked, it's IV right now because it's connected to fluids. Right lower forearm, right wrist, you want to just describe where it is, okay? All right, now we should have a medication nurse come in and give him some additional medication. So thank you, Mr. Jimmy. Sorry I had to stick you a few times, but these medicines will get you feeling better, okay?
Thanks, May.
You're welcome. Now make sure that you clean up your room before you leave. Any trash, even these unused supplies that we won't use again, and throw those away, okay?
Hey, Mr. Jimmy, how are you doing?
I'm all right.
Well, that's not what I heard. I heard that you, your previous nurse, Miss May, said that you were hurting. You were not feeling very good.
Yeah,
She
I've been
said
having some pain.
Yeah, she said your pain was an 8 out of 10. Is that true?
That's right.
Okay. Well, the doctors ordered some morphine for you. Okay. Have you ever had morphine before?
I don't think so.
Okay. Well, it's a pretty strong medication that I'm gonna actually give you through those IVs that May just started for you. So I'm gonna get all that together. But first thing, I know you're tired of us asking, but can you tell me what your name is
Jimmy Hoffman.
and your date of birth?
I forgot. 1/14/42.
Okay, perfect. Okay. Well, I'm gonna go over to the computer for just a minute. I've already looked at the orders, but I want to look at them again just to make sure that we've got the correct orders and then I've got all the right medications. So I'm gonna move my table over here and kind of peek at all that first, and then we're gonna look at your IVs. Are your IVs feeling okay so far?
Yeah.
Okay, haven't had any problems with them? They're not hurting or anything, are they?
No.
Okay, good. Well, I'm gonna peek at those in just a minute, just make sure. I'm sure May did a great job putting those in, but I'm gonna make sure that those look okay. So the one thing I'm gonna do is I always wanna make sure that I've checked these orders outside of the room. You always wanna check those first before you come in. So I verified that the doctor's ordered morphine. And sometimes you'll see that they have 2 different types of medications ordered for pain. Sometimes it'll be for pain from 3 to 5, it'll be this. If it's above that, it'll be something different. So in this case, he said his pain was an 8 out of 10, so I'm gonna give him some morphine. The orders, I see that the orders have ordered for him to have 2 milligrams of morphine. So I'm gonna verify that. I wanna make sure, first of all, we always wanna make sure that we got the right patient. We did that, right? So we made sure I had the right patient. I wanna make sure that I've got the right drug. So I've already been to the Pyxis. I've come in, I made sure that I've got my morphine. And then we wanna make sure we have the right dosage. So I'm gonna always verify that with the MART again to make sure that the doctor's orders are gonna be, so the doctor's ordered for 2 milligrams of morphine to be given PRN. And so I've looked at that. I'm gonna verify that. With these dosages, now when you're in the hospital, most of them are gonna perform a lot of that math for you, but we're gonna go through that today. So I've got my orders for 10 milligrams per milliliter, okay? The doctor's ordered for 2 milligrams of morphine to be administered. So I know, I've already done my math, and I'm gonna be giving him 0.2 mils of morphine, okay? It's a small amount, right? So that's why we're gonna talk about drawing something this small up, okay? So I know that I've got this. Let's talk about the route. How do we administer morphine? Well, we're gonna give this morphine through his IV, okay? So we're gonna want to make sure that we have the correct route. Okay, so we've got our dosage, we've got our route, and then we're going to kind of make sure we verify that with the computer. Okay, so I've gotten all of that. I'm going to go ahead and put some gloves on since I'm going to be touching his IV and verifying. So I've already got my hands clean. All right, Mr. Jimmy, I'm going to check those two. I see that May put in 2 IVs. Is that correct?
Yeah, I don't know why.
Wow, you got 2 IVs. Well, there's a reason that we do that. So I'm gonna look at those first. I'm gonna drag my big old cart over here. And as we've said, there's a lot of different ways you can do this when you're bringing your medications into the room. I like to bring my medications into the room and do it. I like to draw it up at the bedside, okay? That way I've verified, I have my computer with me. I've verified that I've already verified that I've got the right medication, but I have all that with me, okay? So Miss May just put in these IVs, but I still, even though I did not put these IVs in, correct? But anytime that I come in to give any kind of IV medication, what do we want to check? We want to make sure that our IVs are good. So I see that looks like there's some fluids in here. I like to always make sure that I have the correct fluids are running, okay? You don't ever want to assume that because the fluids are running that it's the right fluid. So I've also, when I look through my medications, I also checked my IV fluids, and the doctor had ordered for him to have some lactator ringers running. So I see that that's what's in the room, and that looks correct. So now I'm gonna look at my IVs, okay? So let's pretend that these fluids were running, okay? One thing we wanna do as nurses is when fluids are running, we still wanna check to make sure that the IV's okay. I don't wanna assume that because it's dripping that the IV's okay? So I wanna check and assess the IV myself. Mr. Jimmy, I'm gonna touch you and just kind of check these IVs and make sure they're looking okay. You said they're not hurting you, right?
No.
Okay, and I see that you have 2 of them. One of them we've got some fluids connected to, right? So we've got our tubing here. And one of them we've got we call this saline locked. Now, one thing I wanted to make a note of, you guys, I want you to look at this. So do you see this right here? Okay, one thing we wanna make sure is that when we have a saline lock or a HEP lock, you're gonna hear some nurses still say that, we wanna make sure that this is locked, okay? And by locked, we need to make sure that this is closed, okay? This needs to be pushed all the way in. Why do we do that? We want to make sure that we're keeping air. This is for infection purposes. We want to make sure this is always closed, okay? So I'm going to close that, and sometimes in a hurry, as a nurse, you'll forget, okay? But we want to make sure that's closed, okay? Now, easy thing is when I'm going to check to make sure that I want to look at my IV site. First, we're just looking, we're assessing, right? How does it look? Okay, so when I look at it, don't just look at this. I don't want you just to look at where the tape and all of that. We want to go down to where the insertion site is, okay? So our insertion site is all the way down here. So I like to actually feel around it, make sure it's not tender. Is it red? Is there blood underneath? Sometimes you're going to see with these IVs that don't have fluids running, sometimes we'll have some caked up blood under that. Does it mean the IV is bad? Not necessarily, but I still want to look at that. Sometimes it just means we need to take it and clean it and clean around it, okay? So I've looked at it. It looks good to me so far. This is a new IV, so it looks good. I don't see any redness. I don't feel any tenderness or erythema or any swelling around it, so it looks good, okay? I'm also gonna peek at my other one before I flush, okay? And make sure the same thing. Now, if we had fluids running through there, we could do the same thing. I still wanna palpate and touch at that insertion site. Make sure, is it going into the vein, okay? Is it going into the vein? Because sometimes what will happen is these IVs will, even though they were fine before, they can infiltrate, which just means it's now flowing. That fluid is no longer going through the vein. It's actually going outside of the vein, okay, and into the tissue. So looks like the same thing here. He hasn't complained of any pain. I don't see any swelling. I've felt around it. I don't see any blood underneath, or there's no redness. So far these IVs, they look good, okay? So for me to know though whether an IV is patent, I've assessed my IV, but now I want to flush and make sure that they actually, okay? So I've got a flush here. I'm going to use this one first, okay? And I'm going to go ahead and check my saline lock first and just make sure that that looks good, okay? So this has been maybe potentially open to air, right? We know that this one has been open to air. So what do I always want to do? You're going to hear us say it so many times, scrub the hub, right? You always want to scrub the hub. Make sure that that's clean. So I love to have my pockets full of these because you're going to use these all the time, okay? And that way, once again, May had talked about having all your supplies. That's one of those things that just load yourself down with alcohol. You can never have enough of these, okay? So I want to scrub that. So I'm going to pull that out and make sure that that's really clean. So I'm going to get that scrubbed, okay? Now you may say, well, she just started this IV. It doesn't matter, right? We always want to cover ourselves. You can never, as I tell people, it can never hurt to scrub the hub, okay? So just make sure that's nice and scrubbed before we're going to flush it, okay? So to make sure that this IV is patent, we're gonna get our flush. Do we need to flush all of it? No, but I want to make sure when I'm checking an IV and to make sure it's patent, what are we going to first do? We want to aspirate, right? To make sure that there's, now in the case of this, we're not going to see that, right? But we want to pull back. And with a fresh IV, you should get a nice flow of blood when you aspirate, okay? That lets me know that it's in the vein, okay? So make sure that when you say an IV is patent, I always want you to pull back, okay? Now, we've talked about how this is a smaller IV, so sometimes it takes a little bit of time to get that. And the longer the IV is in, sometimes you're gonna find after day 2 or 3, sometimes it doesn't aspirate as quickly as it does when you first put it in, okay? So I've aspirated, I see good blood return, so it lets me know that it's in the vein. And then I'm going to slowly, what do you see that I didn't do, right? Okay, so this is a good thing because this happens all the time. Oh, the IV is not good, and you realize that it's just because you just simply didn't unclamp, okay? So make sure before you do that, we're gonna unclamp. We're gonna make sure that that's open, and sometimes these can be stuck. It's okay, all right? So I've loosened that, okay, so that I can actually. So in reality, would I have gotten blood return? Probably, if that's you. Always wanna make sure that's unclamped, okay? So then I'm gonna push nice and slow. And y'all, when you're flushing, you don't need to do 10 mils of, when they're saline locked like this, I like to really make sure that because sometimes you're gonna find that people are not doing a good job flushing these. And so sometimes you'll have to actually put a little pressure in to even re-engage that because they can clot off a little bit if they haven't been flushed regularly. So just always make sure you're checking these lines because sometimes they're not used as often, okay? So it's going in nice and easy, okay? And I'm gonna put in about 5, and I feel good about that, okay? After I've checked that, I can then say this line is patent, okay? So then once again, if I'm not gonna be using that line, what do I wanna do with this? Okay, I wanna lock that back, okay? We're locking it. That's kind of essentially what we're doing when we do that, okay? All right, so I've checked that IV. I feel good about this IV. Now, if I have fluid running through this, do I want to assume that this IV is patent? Okay, we've already checked it. We've checked the line, so do I need to go in and flush it? Not necessarily. If I've checked the IV, I see that it's flowing. I don't see any reason to stop that, okay? So I definitely want to make sure that this line is nice and patent, okay? If there's ever any concern, what can I do? Can I pause my pump, right? And I still can flush the line. Right now, I don't see any reason that I need to do that, okay? So I've checked both of my lines. Both your IVs look great, so I'm gonna give you some medication. I know you've been waiting, you're in pain, so I'm gonna go ahead and get that medication drawn up and give it to you.
Oh, good.
Okay. Something that I wanna tell you too, when we have an order, like a list of medications that we're giving a patient, if a patient is in pain, what do you think what would be the first thing that I should probably give my patient? If I know his vital signs look good, and his blood pressure looks good, and his heart rate looks good, all of that, what would you think would be the first thing? Give them the pain medication, right? Let's go ahead and try it. Let's go ahead and take care of that pain, okay? So we're gonna go ahead and draw up our pain medication, okay? So I see both of my lines are good. And I'm gonna teach you there's multiple ways that you can give. When we have 2 lines like this, one of the big things we wanted to discuss is compatibility. If I'm going to give a medication through a line, okay? I want you guys to see all of this. And this is running, and I've already got fluids. I know that I'm running, what are we running? Lactator ringers, okay? I want to make sure that the medication that I'm giving is compatible with that, correct? You always want to make sure, because don't assume that it is. A lot of times we're going to have patients getting maybe dextrose, or they've got electrolytes running, and that is one big reason that we sometimes have 2 lines going, okay? You're going to see this a lot, so that we have the ability to be running the electrolytes and some of those other things, and then we have a secondary line so that we can give those push medications. We can give other medications that they might need, okay? So in this case, he's just getting some lactator ringers. I'm gonna go ahead and just give him some morphine through that line, okay? So we're gonna go ahead and do that. We're gonna pretend these fluids are running, okay? In reality, what I would do, I always like to, you're gonna see different things in the hospital, okay? But I always like to pause my line, right? Depending on what they're getting, that's a safety measure, okay? So I want all of you to look close to this pump, and I'm gonna be going through this in a little bit when we hang a secondary or a piggyback. But this is your hub, guys. Get used to this. This is where your pause button is. It's very, very easy to see, okay? So that's what I'm gonna hit. I'm gonna hit pause, okay? And then I'm going to, and I'm gonna hit pause once I get my medications drawn up, okay? Let it run, don't let it pause it because you're gonna have 2 minutes, okay? And so if you go ahead and hit pause and you're scrambling over here to get your medications drawn, it's gonna start beeping at you, okay? Go ahead and let them continue to get fluids while you're getting your stuff together, okay? So I'm gonna be giving him morphine. Do we decide how much I'm giving him? I'm giving him 0.2 mils of morphine, okay? That's a small amount, okay? So in reality, most of these will have a top, okay? Those tops are sterile, okay? So a lot of students ask, do I have to wipe the hub? Well, if they've got a sterile top, you don't, okay? Now, in the case that it's a container that's been open to air, anything like that, I always am gonna wanna wipe that, okay? Always. Okay, so we're gonna pretend this had my sterile top. I'm taking off my sterile top to drop my morphine if this was just a single dose, okay? And I'm gonna get out, because this is such a small dosage, you're gonna wanna get your smallest syringe possible, okay? This is a 3. They make them as small as 1 mil, okay? We're drawing up such a small amount. This is a safety issue, okay? Always get the smallest syringe possible when you're dealing with something like a narcotic or something like that where you're using just 0.2, okay? So in this case, we didn't have a 1 mil syringe, so I'm gonna still go to the smallest, which was a 3, okay? So I'm gonna grab that. I've gotten my sterile top off, and I'm gonna go ahead and get my syringe out, okay? And I'm gonna draw this up. Remember, we're drawing up how much? 0.2 mils, okay? So in this case, I've got my sterile. I'm gonna get my needle in there. And I want y'all to look closely. This is a small, small amount, okay? So we're gonna come up here and we're gonna just draw. Now in this case, okay, so I want you all to look at that, okay? And if you're ever anxious about it, and we've got our needle in there, we can always look. I always tell people you can draw up further if you're worried about it and then go back up, okay? Now, when I'm giving narcotics, I always like to double check with the nurse. So I'm gonna ask Miss May to come in here and check my dosage, okay? And make sure. May, I've got an order to give Mr. Jimmy 2 milligrams of morphine, and I just want you to double check. I'm supposed to give him 0.2 mils of morphine.
All right, it's 0.2 mLs. That's correct.
Great. So I'm going to go ahead and so I've got my 0.2 mils. I feel good about that. Okay. So first we're going to give him through this. We're going to give this to him through the line that he. We're going to give this through the line that's got fluids running. Okay. Now in this case, I've got my open needle. So what I'm gonna do is I'm gonna close my needle, right? I'm gonna close that and I'm gonna set this here. Now, if I was outside of the room and I drew up my morphine, what would I wanna do with this? Maybe put a label on it, okay? You're always gonna label your medication because sometimes you'll be giving 2 or 3 medications, which is another reason I like to give it at the bedside, okay? So I've got my morphine and I've got my syringe, okay? And I've got my flush. Now in this case, if we're gonna do it through the line, once again, I've told you, we're gonna come over here, we're gonna pause the machine, right? So we're gonna pause our machine. I'm gonna come through. Now this is the closest hub. I want you guys to look at this, because this is a very confusing thing for people, okay? A lot of people think they have to disconnect their tubing and all of that. Well, this is what this beautiful thing is right here, okay? This is the proximal port. So this is where we're gonna administer our medication through, okay? Once again, has this been open to air? It has, okay? So once again, you're gonna feel like you're taking out alcohol swabs over and over and over again, okay? But we're gonna clean this, okay? Once again, even if May just started an IV, I still wanna make sure, okay? So I'm gonna have this here, and I'm gonna get my flush. And the first thing we're gonna do is, now, are there ways to dilute this? Yes, there is. I've got fluids running, but because this is such a small amount, I'm gonna show you a different way to do that, okay? So we're going to flush just a little bit, all right? Now, morphine, let's talk about, because one of the most important things when you're administering narcotics or administering anything IV is we want to know about time, right? We want to make sure that we're giving things in the appropriate amount of time, okay? Do you think that morphine is going to be a medication that I'm going to just blow and go with? No, I'm concerned, because what are some possible side effects with morphine? Respiratory depression, hypotension, right? Decreased heart rate if we give it too rapidly, okay? And Mr. Jimmy, is he an older fella? No offense, Jimmy, right? So with my older fellas or my older people, I want to be very, very conscientious of that. So I've already assessed his vital signs prior. I made sure that his blood pressure looked good, his heart rate looked good, He's breathing okay. He's not on any oxygen. Okay? But all those things are very, very important, okay? You always assess your vital signs before you're giving narcotics, okay? Very, very important, okay? So I've paused this. I've got some fluids running, but just to make sure, I'm gonna go ahead and just push a little bit in the line. And then we're going to administer our morphine, okay? So I've got to, once again, you're catching me now, we're gonna go ahead and wipe the hub, okay? Since this has been open to air, I'm gonna clean that real good, okay? And I've got my trash can right there, so I'm gonna put that in there. Okay, we've had fluids. You're gonna see a lot of different things because we've had fluids going, okay? I've paused my machine though, so we've already paused that. So I'm gonna go ahead and connect my flush. Okay, do I need to push a lot? No, we're just gonna let's just do a little bit. Once again, this is also letting us know, I'm always looking at my insertion site to make sure that that's looking good, okay? Still no pain, Mr. Jimmy, right?
Nope.
Good, okay. So I'm gonna put in about 3 mils. Now morphine, what do y'all think? How do you think that's administered? Okay, we're gonna give our morphine nice and slow, right? Okay, so we're gonna sit here. Now, here's my preference. When I'm giving something like morphine and it's 0.2 mils, right? We're giving this over we really wanna give this slowly, right? We're gonna maybe give this over here's the thing too, we're always gonna consult our drug guide, make sure that we're giving this in the proper amount of time. With morphine, we're gonna give this slow, okay? Really, ideally, we really like to give about 1 milligram per minute. So I wanna give this over 2 minutes. So I've got a small amount of fluid here, right? So I'm gonna show you this way, and then I'm gonna show you how you can dilute this as well, okay? So I'm gonna remove my needle, and I'm gonna connect that to the hub. Okay. Now when I'm giving medications really, really slowly, I like to talk to my patients, right? And I'm gonna be watching, most of your rooms are gonna have a clock, so you can use that. Or what else are we wearing to clinical? What are we wearing in the hospital? We're wearing our watches, right? So I'm monitoring that, okay? So I'm giving this over 2 minutes, okay?
Hey nurse, what did you say your name was?
Did I even tell you my name? And I just barged in your room?
Yeah.
Oh man. My name is Hava. Can you remember that? It's a hard one.
Hava.
Yeah.
Okay.
So do you have any family that's gonna be coming to visit you?
I do. I'm married.
Where's your wife? Is she on her way?
She is. She went to the coffee shop.
She went to the coffee shop. Is she getting you some coffee?
Yeah. Can I have it?
We're gonna have to check your orders and see if you can have some coffee.
Do you like coffee, Hava?
I love coffee. Do you know I have a coffee shop?
Do you?
My husband and I lived in a coffee
what's your
farm
favorite?
for 6 months, actually, in Guatemala.
Oh, wow. Do you like dark roast or?
I drink my coffee black. I kind of like dark roast, but I normally like the lighter roast, actually. I always say that I don't like it like burned.
You know who has good coffee?
Who?
Jack's.
Jack's? I've never
They
had
have
it.
good coffee
Yeah,
at
that
Jack's.
with your
It's
chicken
real
biscuit?
cheap. Oh, yeah.
What you eat it with?
Chicken
Yeah.
biscuit, yeah. Fried. Good and fried.
All right, you're gonna probably feel this, okay? So if you start feeling something and start feeling a little funny, because you haven't had this before, have you?
No, I've never had it.
Wow. So this
Kinda
is really gonna get. So when we give something through your IV, Mr. Jimmy, it gets in there nice and quick. So you should start feeling this real quick. So I'm looking at my watch. I'm making sure I'm giving this the appropriate amount of time. I know it takes a little bit of time for us to give this to you, but we just want to give it to you nice and slow so we can give it to you safely. But this should get that pain. And what I'm gonna do, Mr. Jimmy, after I give this, is I'm gonna come back in a little bit. I'm gonna check on you. I'm gonna make sure that pain's going down, okay? And don't get mad at me, but I might bring my vital sign machine in here too and just check your blood pressure and check your heart rate, make sure all that looks good too. Is that okay with you?
Yeah.
Just want to make
I'm
sure
feeling
that
good.
I bet you're feeling good. Okay, so I've given this over the time frame. Okay, so after I've done that, here's the thing I want you to know when you are reflushing. Okay, after you flush, after you give a medication, there's still going to be some in the chamber. So do you think that I want to push this fast or do you think I want to push it slow? Once again, we want to push it nice and slow. Okay, we've just given a narcotic. Okay, so I'm going to reconnect my flush. And we're gonna connect that nice and slow, okay? And we're gonna push nice and slow. All right, Mr. Jim, you still feeling good? How's that pain? What would you rate it at?
Woo! 9.
That's perfect. All right, so.
My nose is itching.
Is it itching? That morphine will do that. You know that's one of the side effects of this drug?
Oh,
and
I
make you
didn't.
itchy. But listen, you let me know if the itching doesn't stop, okay? But just know you may be a little bit itchy.
Okay.
Okay?
Hava, right?
But the main thing I want to do, you got it, Hava. You should have slapped me for not telling me that I didn't tell you my name.
You might have.
I just
I
came
probably
barging
forgot it.
in here. I don't know if I did or not. All right. Well, I'm going to be checking on you here in a few minutes, okay? I got a couple other things that I got to give you. Are you with me enough to listen?
Yeah, I'm listening.
Okay. Well, your doctor ordered us to give you an antibiotic, okay? Because you've got that little infection, and that's what that antibiotic's for. I'm going to give it to you through your IV, though, so you don't have to swallow any pills or anything like that. But we're going to give you an antibiotic for you to take, okay? It's going to run over an hour, but hopefully you won't even know that you're getting it, okay? But I'm going to give you that. You know, one thing that we didn't talk about either is allergies. Did any of us talk about allergies? Okay. Now, I see in your chart that you don't have any allergies, but do you know of any allergies that you have?
No.
Okay. Just want to make sure. Well, we're going to go ahead and get you that antibiotic as well. I just want you to know what I'm doing, but hopefully you can get kind of a nice snooze in here and you start feeling better. And I'm going to check on you here in a few minutes too, just to make sure that your pain is continuing to go away. Okay? Okay. So once again, we're going to get all of our supplies. Okay? We've got my trash can right here. May already talked about that. Syringes, sharp needles, all of those need to go in the sharps container. Okay? We want to make sure that we put those in a safe environment. So I'm going to put those in the sharps container. Make sure that you will properly dispose of those. Okay? One thing that we did assess, we saw that his pain, you know, with a medication like morphine, we expect that to be quick, right? It's going into his bloodstream. Now, if we give him some Norco or something by mouth, what I'm expecting maybe it's going to take about 30 or 45 minutes. Communication with that patient is really important. Let them know that, okay? Let them know it's going to take some time for that to settle in. Now, morphine's going to be nice and quick, okay? It's in that bloodstream quick. So I want to also make sure, he talked about itching. That is a normal side effect of morphine. Would have been a good thing for me to even tell him about since he's never had it before. But I want to be monitoring for those side effects that would be, let me know that something may be wrong with him, that he may be having an adverse reaction to the medication, okay? I definitely want to be checking to make sure his vital signs are stable, especially when you have an older patient, okay? Always make sure that those look good. If I'm going to give him a medication if we're going to give it through the saline lock, we're going to go about it in the same procedure, okay? You want to make sure that we are flushing prior. We call it kind of we're going to flush, push, flush, okay? You flush, then you're going to push, and then we're going to flush. Big thing with that second flush that I told y'all is you want to make sure that you're giving that nice and slow, okay? If we've got medication, we've given that slow, but you never want to push fluid through that into the vein, okay? That can cause some of those adverse reactions we were just talking about, okay? Now, with a medication like morphine, that's 0.2 milliliters, was that an ideal way to administer that? My preference for administering something with that small a volume, and for your sake, so while you're in there having a conversation with Mr. Jimmy over 2 minutes, maybe even up to 5 minutes sometimes when we're giving these narcotics, is you want to dilute that medication. It makes it a whole lot easier. To me, it's in safety. It's an issue of safety. It allows you to give it much slower when you're dealing with more volume, okay? So for drawing that up, we would do that in the same format, okay? In this case, we're going to use we would want to once again use the smallest syringe possible, right? Which would maybe be that 1 ml syringe in place of a 3 ml syringe. So I'm going to go about it in the exact same way, okay? I've already locked, so this, as you guys know, when this is locked, right? I can't reuse that, which is a good thing, okay? That's locked, that's in my sharps container. But I would draw that up in the same format, okay? I'm going to drop 0.2 mils of my morphine, okay? And one thing you can do when you're giving medications, and we'll get into that as we kind of go through other things, but a lot of people would draw it up into a bigger syringe, especially when you're drawing up medications that are like 2 mils or maybe even up to like 5 mils, because that way you already have that bigger syringe ready to go, okay? But in this case, because I'm drawing up such a small amount, I want to use a let me see if I have another needle, actually. This one is, yeah. Do you know if there's another needle? Hold on.